Hi everyone, my name is Carolina Gabarczyk. I will be going over the overhead squat, specifically to seeing a lower back rounding. The table of contents, what we'll be going over is the evaluation portion of the patient, any type of impairments, over or underactive muscles, as well as the exercise program specific to that patient. To begin with, when we look at the evaluation, it is pretty much going to be an essential thing for us to see any type of crucial information prior to meeting with the patient, specifically any type of medical history that can be collected. Secondly, when performing the evaluation, it will allow for us, the therapists, to identify any types of impairments. For example, when we do a static posture assessment and a transitional movement assessment. This can help to find an effective program for the patient to help re-educate them on new techniques to further prevent any type of impairment. As we discussed in class, we did talk about how our body is a kinetic chain, and specifically when we're doing an assessment, we're going to look at the kinetic chain checkpoints, specifically to the foot, ankle, knee, the lumbopelvic hip complex, as well as the shoulder and cervical spine. So when we talk about the overhead squat assessment, we're going to be looking at the anterior, lateral, and posterior view, and we're going to just look at some different types of checkpoints, seeing if the feet are flattened or turned out, the knees are either going into knee valgus or varus, and then in the lateral view, we're specifically going to be looking at the spine and seeing if there's any excessive spinal extension or flexion, and then lastly, the posterior, seeing any excessive pronation or any type of asymmetrical weight shifts. So here is the analysis that I did. And the purpose of the overhead squat specifically is to assess any type of dynamic flexibility, core strength, balance, and overall neuromuscular control. This assessment is used to support the transitional movement assessment. The specific exercise shows how the lower extremity movement patterns occur if there is an impairment showing overcompensation or undercompensation of certain muscles. When I did the analysis seen from the previous slide, the patient performed an overhead squat in order to see if they had any types of impairments. Specifically, what we found was that the patient in the lateral view had a visible alteration where there's an excessive forward lean. Possible overactive muscles could be the gastrocnemius or the underactive muscle of the gluteus maximus. And the biggest thing that we did notice was in the lower back that it did round when going into the squat phase. An overactive muscle could have been the hamstring complex, or underactive muscle could have been the gluteus maximus. And so when we're going to go into the corrective exercise continuum, I will be showing you the video that I did record explaining what specific to this impairment, what we're going to do.
So the first step for the exercise program, we're going to do the inhibitory state, where Olivia is going to perform a self-myofascial release using a foam roller. She's going to hold on the tender area on the back of her hamstring complex for 30 seconds. All right, Olivia? The second step is when we're going to lengthen the muscle. Specifically, we're going to focus on static stretching. So we're going to focus on the hamstring complex as well, and we're going to hold this stretch for 30 seconds. All right, Olivia, do your stretch for the hamstring complex. And make sure you fully extend the leg and hold for 30 seconds. The next step is going to be the activation process, and we're going to focus specifically on isolated strengthening, specifically the gluteus maximus. So in this case, we're going to do 4 repetitions and increasing the intensity by 25, 50, and 75. So Olivia's going to be performing a glute bridge on a Bosu ball. You want to do that for me, Olivia? Do 3 more. The last step is going to be the integrated process. This is where we're doing an integrated dynamic movement. And so Olivia will be performing a squat with a overhead press with the ball. You're going to complete this with a 10 to 15 repetitions, and you're going to do this in a controlled setting. All right, Olivia, you can start your exercise. Nice and controlled, 10 to 15 repetitions. You want to
And then the last slide is just explaining everything word by word, discussing about the different types of modalities that we would do in different types of phases in the exercise, corrective exercise continuum, the different types of muscles that we're going to focus on specifically, and then the acute variables, meaning how long we should hold a stretch for how many repetitions we should do during an activation exercise, specifically isolated strengthening, or in the integration process. We're specifically going to be doing controlled repetitions for 10 to 15, and this is all specific to seeing an impairment during an overhead squat when your lower back does round. And these are my references.